the blockage was or where it was, or
Well, sometimes like you just don't know how, like you don't know how bad the blockages are. Sometimes you may have a wound on one side and you may have like a minor wound on the other. It just kind of depends. Everybody's body does it a little bit differently, and sometimes we can go in there and start messing around with stuff, and then other things can become like a little bit occluded. Got this stuff all over you.
was the I guess a blockage in the sense that was it
So there's 3 arteries that run down your leg.
okay?
Well, so there's one. So it splits at your belly button and forms into 2. Okay? That's what your diagram looks like. So it comes down here to your knee, and then behind your knee, it kind of splits off into 3. After it goes behind your knee, it splits off into your front, which is your anterior tibial, your back, which is your posterior tibial, or your peroneal, which is the one that comes down the middle.
Yeah.
Okay? So the one that feeds the heel, kind of feeds the heel and up towards the bottom of the foot, that's your posterior tibial. So, and that comes down into this little dotted section right here is the pedal loop or lateral plantar. So that artery runs center of the foot. Okay? So when he got in there today, he discovered that this entire artery down the back part of your leg that feeds your heel and the base of your foot was completely blocked.
Well, okay.
Okay? So what he did when he went in there is instead of just going in and like ballooning it open, so we put that balloon in and kind of inflate the balloon and pushes that plaque to the side, he ended up doing an arthrectomy, which I think they did on the other leg also, where they go in and use that laser and that little Dremel to kind of roto-rooter and clean out the pipes. So that's what he did to get all this cleared out and then into the base of your foot.
Okay, so what will I notice from that?
So it may take a couple of days for the wound to start getting better. It may take a couple of weeks, but since you've got that improved blood flow down there now, you should start getting those nutrients and oxygen and all that stuff that's going to help it heal. Because the other 2 arteries feed the top of your foot in the middle. So when you got a wound on your heel, if you don't have adequate collaterals and this one on the back is clogged off, then it's not going to get what it needs to heal.
Yeah.
So that's why he went in and cleaned this one out today.
Yeah, I didn't know whether you see a lot of blood, or do you see I don't know what the appearance is to him when it
So
clears up.
it's plaque. It's like little like fat deposits that deposit just like they can deposit on your heart, they can deposit in your arteries. So it's not a blood clot where we could kind of dissolve it with a blood thinner. It's thick plaque that kind of develops over time.
Yeah.
And everybody gets it to some extent, but some of us tend to get a little bit more of it. Things that typically make that worse are smoking, diabetes, high cholesterol, high blood pressure. Those things kind of accelerate the disease process. And that's what can make it worse. But most people don't know they have an issue unless they get pain in their legs or they get a wound.
Okay. If you have neuropathy and you're diabetic, then you don't feel it. Sometimes you don't know it or you don't feel it as far as.
Right.
So that was the other question.
Yeah, so sometimes that's how you get the wound the first time is because you can't really feel it. Okay? So we'll have you come back and see us in clinic because that should help your foot. Should help the back of your leg and your foot on the right side, okay?
Right.
Okay.
Did it help my foot in sense the healing of the wound?
Yeah, it should help. Well, it should help a lot of things. It should help the healing of the wound. It's not going to heal your neuropathy, but it may make it a little bit better because now you've got blood flow down there to those nerves and stuff. But ideally, the focus is we want to make sure we can get these wounds getting better.
Yeah. And as far as my existing one, on the left side, we already had this procedure done on. I guess the thing there is, and I guess you can't tell much about that, but on the left side, but I guess they look at it whenever they do the thing with a boot or shoe, so that they can see. I'm wondering, at this point, what pressure do you put on the right foot in the situation we're in? Is it just something I don't put much pressure on, or does it matter, or what is it?
Well, in theory, you don't really want to put too much pressure on either one until they're both healed.
Yeah. I mean, so, I've got shoes that are supposed to keep more of the pressure on the front part of the foot anyway, but it's okay. I mean, it should be okay to be doing more as far as eating. Just what I've been doing, but just avoiding anything that would put pressure on the heel or keep it off the heel, I guess, at this point.
Yeah. Just try not to keep that pressure on there. Especially like if you're laying in bed, if you can prop your legs up so they're not in contact with the mattress.
If you are, you know what I mean? Maybe if I sleep, when I sleep, a lot of times on the right side, just the way I've normally done things. I don't know, is it better for all this to be on your back to sleep all the time, or does it matter?
It doesn't matter. Whatever's comfortable for you.
Okay, so I don't have a problem with having to. Sometimes that's when you start having trouble getting your breath and everything. I mean, you know, just normally, that's the way I've always adjusted to it, so that's good. But did it look pretty serious in the sense it sounded like it was blocked? It's pretty.
It was blocked, but he got in there and cleaned it all out.
Yeah, but I mean, that in itself could cause a lot more damage or more wound or more, just because it did. Was it clean where you could heal, I guess, or I mean, it might sound like it would be serious enough to prevent a lot of other things from happening.
Yeah, I mean, it was preventing you from healing.
Yeah, so the healing part of it might be improved quite a bit, it sounds like. Yeah. So what I was trying to think about is what the bottom line is. And as far as doing anything or activity, right now, just stay off of it as much as possible. Or
Yeah, I mean, you're going to have to stay off of it for a couple days because we went through your groin for that access site.
yeah,
So you're going to have to kind of take it easy and not do too much aggressive, like, physical therapy or anything.
that's what I want to make sure that I don't know if I get any kind of orders or anything that further I pass on to the therapist there.
Just, I mean, like no physical therapy with weights, like as far as like putting pressure on your groin for a couple days.
Okay.
But we're gonna send you the discharge instructions that I'm gonna send you with. She can look over those too, and she'll have like a better idea of what she can and can't do with you. Just trying to figure out. It says there's a leak.
No, what?
It says there's a leak.
Okay. You were talking about a leak over there on that right foot then.
I'm trying to figure out where the leak maybe is.
Well, there's been one thing where they had broke loose at one time, and they tried to do a tape thing, and
Well, we'll see if we can fix it a little bit. I don't know if I can.
well, I mean, there's some nurses that people can look at it.
When you get there?
Yeah, at the you know. But then again, I go see the wound clinic on Wednesday.
Yeah.
So that it's all kind of lined up to kind of follow up there, plus at the wound clinic, and they're kind of. But you know, you always felt like that some of the issues were because of this blockage or whatever it is that might have.
Yeah, I mean, the reason your wounds aren't healing is because they're blocked.
Yeah.
Like, by getting those blockages out, your wounds should start to look better.
Okay.
They should start to slowly kind of heal and start looking significantly better.
Well, that's what we want to do.
So
I don't know about the pain or whatever comes out of something like this, but
you shouldn't really have too much pain.
okay.
You may have a little bit of soreness, like in your groin area where we actually went in.
Yeah.
You may have a little bit of soreness down in that leg, but you shouldn't have any type of excruciating pain, not anything super